Welcome everyone. Thank you very much for joining us today for BLM2 ICAM4 conference. My name is Shafaq Sai. I'm a Master of Sciences in Occupational Therapy and I would like to share our latest research project on the relationship between quality of life and coping strategies in patients with COVID-19. As you can see in this picture, I'm preparing here to visit patients with COVID-19. To have an introduction in this regard, I have to mention that the pandemic COVID-19 affects the mental health and quality of life of the population. Many factors affect quality of life, including stressors and coping strategies. Patients with COVID-19 suffer from many types of stress and have difficulty in using coping strategies for life stressors, which in turn can affect their quality of life. Therefore, it's important to identify coping strategies in these patients. This study was performed to investigate coping strategies in patients with COVID-19 and their relationship with quality of life. The review of literature demonstrated that patients with COPD have minimal use of coping strategies and don't find them useful but have a high quality of life. And also, people with suspected COVID-19 symptoms were more likely depressed and had lower health-related quality of life. Moreover, in the research of patients with acute respiratory distress syndrome, mental outcomes consisting of post-traumatic stress disorder, depression, and general anxiety have reported. You can see our problem and hypothesis in this research here, and I wanna skip it right now. As you see, this was a descriptive analytical study and was performed at Imam Riza Hospital in Tabriz City for 2 months from May 2020 to June 2020. As the Imam Riza Educational Hospital is the main referral center for patients with COVID-19 in East Azerbaijan in Iran, it was chosen as the location to conduct this study. A sample of 70 hospitalized patients with COVID-19 was selected by convenience sampling. And we have used 3 instruments in this research, such as Coping Strategies Questionnaire, World Health Organization Quality of Life Scale brief version, and Demographic Information Questionnaire. Here you can see the demographic information results, and as you see, most of the patients were employed. And the mean score of problem-oriented coping and emotional-oriented coping strategies were 66.40 and 63.51 respectively, which shows that patients with COVID-19 have used a more problem-oriented coping strategy. And also, a direct and significant relationship, according to Pearson results, was found between the score of the physical dimension of quality of life and the problem-oriented coping strategy. The results showed that the lowest mean responses to quality of life questions were related to social factors. It thought that the low mean score obtained in the present study from the social dimension is due to the limited access to social support systems for patients with COVID-19 in our country. In addition, the results showed that most of the subjects or participants in the present study used problem-oriented coping strategies. Researchers believe that patients with COVID-19 spend a lot of time thinking and consulting with others about solutions to their problems and actively trying to respond to the pressures in their life. In the present study, a significant relationship was observed between the physical quality of life and problem coping strategies. The four main variables of social and economic status, family, disease severity, mental status, and coping strategies can affect the quality of life. On the other hand, poor quality of life in people can lead to ineffective coping mechanisms that increase stress and make the disease worse. The results of the present study demonstrated that COVID-19 has the greatest impact on both physical and social dimensions of quality of life. The self-care program is an inexpensive, non-invasive, non-pharmacological method for the treatment of physical and psychological problems and can easily be conveyed to patients and their families by rehabilitation specialists, especially occupational therapists. Therefore, the need-based information transfer in the area of self-care through training, monitoring, and support and the implementation of this program can be used to control physical and psychological problems in patients with COVID-19. We have some limitations, and this study also had some limitations, including the fact that all hospitalized patients in all age groups were examined, considering that people's experiences increase with age. It may affect coping techniques that are suggested to be considered separately in future research in different age groups. And I hope that we can defeat the coronavirus, and with thanks for your attention.